Even today, we still see a lot of parents and non-professionals feel that a concussion occurs only when somebody is knocked unconscious, when in fact less than 9% of the cases of concussion, especially at the high school and youth level, occur in the presence of a loss of consciousness. Additionally, what we see is that many parents and non-professionals fail to recognize the emotional changes that occur with a concussion. Even at the professional levels, we assume that an emotional response is something of despair, when in fact it is the brain's response to an injury, and it may not be voluntary. This could include crying uncontrollably on the sidelines. This could include having irritability and mood swings after a concussion. So it's very important that our families recognize that this indeed is a sign of a concussion. It can be difficult, especially in the adolescent population, when there is a lot more depression and anxiety. But at the same time, because concussion can make things worse, we tend to see worsening of underlying anxiety, worsening of underlying depression. And unfortunately, in our society, psychiatric disease and psychiatric change is very taboo. But it is critically important to recognize this and, when necessary, treat it appropriately. Sometimes it's not always apparent that a concussion has occurred. One of the key factors in asking a patient, an athlete, or somebody who may have sustained a concussion is, tell me exactly what happened. If there's a gap in memory, even though they may not have been knocked unconscious, then that's a pretty strong sign that indeed a concussion occurred. And then you ask, what are some of the things that you're feeling? Dizziness, headaches, mood changes is really a big issue that's not always recognized, and some of the thinking changes. And so when you have a full spectrum of understanding of what the brain does and how that can change as a result of a concussion, then you can better approach athletes, especially youth, after such an injury. An ultimate streamlined process, of course, starts with education. Having the education for an athlete pre-injury, returning to that education after injury, as well as participating in baseline testing and post-injury testing. Anticipatory guidance, meaning knowing what to expect after a concussion, is critically important for the health of the athlete. So they know, okay, it's normal to have a mood change. Okay, it's normal to have headaches. I expected that. But having dizziness and trouble thinking in school might not always be on the top of their mind. In addition, having tools such as Impact for post-injury comparison to see where they lie, as well as making recommendations for what might be needed in an academic setting, as well as in a physical setting. We've really moved away from scare tactics when it comes to concussion, and towards empowerment. By that I mean, when we're talking about concussions, we used to say, danger, 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 you're going to have hemorrhage of your brain, bleeding of your brain, and indeed, that is still important to convey as a part of the message. However, we are now focusing on how important it is to play healthy, whether it's to you, to your teammate, not just for this game, the following game, the state championships, and year after year. And so we really are trying to adjust that message so it is empowering, and it is a positive message about playing healthy, including when someone has a concussion. We've been really pleased since we've been educating our youth. They are now more aware of it than the parents. They are now identifying concussion in themselves and in their teammates, and telling an athletic trainer, telling a coach that so-and-so isn't right, they should be checked out. And of course, when in doubt, sit them out is the mantra, making sure that they are removed from further harm and play.